last week we talked about this, but September is Sickle Cell Awareness Month, and we talked a lot about what sickle cell is, how it affects individuals, and how, again, it's very important to know your family medical history, and very, very important to know the family medical history of those that you know may connect with, your loved ones. And the reason I say that is because, as I talked about last week, I have a first cousin who had the sickle cell trait from his dad, and young lady that he was with for some years, they ended up having a daughter. Well, she also had the sickle cell trait, and my cousin Cachet was born with sickle cell and passed away at a very young age. Stayed in and out of the hospital all her life, and was dealing and just kind of learned how to deal with that pain. And we talked about how, when it comes to us coming into hospitals and stuff, anyway, not all the time, but a lot of times we come in there and we have issues, and they kind of like brush us off sometimes, because it's like, okay, well, you good, you don't need whatever. And with sickle cell, people that deal with sickle cell, they go through what they call crisis, which is literally you are hurting, you have pain from the inside out, your blood cells are not formed correctly, and so you walk you walk in there and you're in pain, and they're like, well, no, you don't really need no pain pills, you just want some, you don't really need it for pain, you just want some drugs type thing. So we talked about that last week, and just let it be known that this month is Sickle Cell Awareness Month.